I'm Dr. Christopher Herrington of Herrington Family Chiropractic. I want to make a note here about chronic pain. It's become a pretty substantial issue in Western New York as well as everywhere else in the nation, but I just know locally it's a really big problem. One of the big things most people don't know is that it is not necessarily a medicinal problem. Pain medications work great for chronic pain, and the fact that you don't need to live with chronic pain. Quite often the allopathic or modern medicine version of treatment for chronic pain is pain medication, which works well for bringing overall pain levels down, but does not do anything to really treat what is causing the pain. That works really well for making the patient comfortable to resume activities for standard daily living, but that pain medication is going to actually address the issue. So what alternative medicine and holistic doctors like myself tend to rely more on is how to actually treat the area. So say you have a disc injury from a car accident and it's causing substantial pain. If you take pain medication, your body will heal that injury, but it will not, or it may not heal it in a way that will stop causing pain. If you take pain medication, what you'll do is numb your senses to that pain and then keep doing poor movement patterns, which will continue to degrade that area until pain gets worse and worse and worse. And until you address that actual faulty movement pattern, you have to treat the site of injury and then rehab the movement pattern caused by the injury, and then rehab the muscles of the area that are going to strengthen the area. So in that same example, say you have a low back vertebral disc herniation. You have to treat the herniation until pain has come down enough so you can actually start fixing the movement patterns that were caused during the injury. So you're hunched over, possibly leaned to one side. Now you have to fix that to get the person back sitting straight again. Once they're sitting straight again, now you have to strengthen the abdominal muscles as well as the glute, pelvic region, as well as the lower limb to then prevent the injuries. This is really the only way that chronic pain goes away. You have to treat the actual cause of the problem, not just the symptoms of the problem. In that same regard, I am not against pain medication. No one should have to live with chronic pain. It is very bad, but a natural, well-rounded style of treatment will be best. That kind of defining that is see an MD, get whatever diagnosis, whatever imaging, whatever they need to have. And if they do recommend pain medication and you're in that level of pain, absolutely take it. I'm not telling people to not take pain medication, but you shouldn't be on it very long term. While you're on pain medication, it is okay to see a acupuncturist, to see a massage, to see chiropractic, to see PT. Seek other modalities, start getting the pain under control, and then as the injury starts getting better, which might be a long time, might take a couple of years depending on how long your chronic pain has been present, then slowly start getting rid of the pain medication if possible. And if in that amount of time you become addicted, then you have to seek addiction therapy to again get off of that pain medication. It is not good to be on long term and will start to have a lot of problems beyond just the chronic pain area. It's just not great stuff. In that same regard, as you start getting healthier, say you're in chiropractic, and as a chiropractor I start rehabbing your pain and start getting you slightly better, the next probable location to go to after chiropractic and you can start moving a bit better, now go to PT. The PT will help, or physical therapy will start rehabbing your ability to actually move and start building structure. The next step beyond that, ideally, would be a personal trainer. Now you can move. Best thing to do is actually strengthen the movement patterns to be able to securely, confidently be able to move without having to worry about re-injury. then just a matter of maintaining that actual movement pattern, that level of physique. Now that seems like a just extremely odd, long kind of treatment, but this is a several year program that I just detailed. It's not something that's going to happen very quickly, especially if you've been injured for many, many years. So in that regard, to any patients with chronic pain out there, there are other solutions. I would highly advise seeking them, at least for a consultation. I know me personally, I am not the kind of doctor that'll say, oh yeah, we'll treat that, when there's no chance of me possibly getting a patient potentially better. If it's not my area, then I'll refer out. If it's beyond my scope of what I can handle, I will refer out to an orthopedic surgeon or a neurologist or whomever else I need to. So that's just me personally. If you have any neck pain, back pain, low back pain, carpal tunnel-like symptoms, anything like that, that is something I treat very, very well. Give my office a call. Contact information is on the website as well as on Facebook at Herrington Family Chiropractic, or the website is BuffaloDC.com. And let's work together to get you better. Thank you. Have a great day.